In a glass-walled laboratory in New Jersey, a pharmaceutical giant celebrates a breakthrough in metabolic research. At the same time, 3,000 miles away, an office worker in Lyon steps out of their apartment and begins a 20-minute walk to work, passing a bakery that uses flour regulated by laws established decades ago. Both individuals are entering 2026. Both believe they live in the most advanced civilizations on Earth. Yet, statistically, the person in Lyon is expected to live nearly 5 years longer, spend half as much on medical bills, and reach middle age with significantly fewer chronic ailments. This is the central paradox of the modern era. As we enter 2026, the United States remains the undisputed leader in medical innovation, home to the world's most advanced hospitals and the highest per capita healthcare spending. Yet, by almost every metric of public health, from infant mortality to life expectancy, it is falling further behind its European peers. While the American system is designed to cure the sick with surgical precision, the European system is increasingly structured to prevent people from becoming patients in the first place. The difference isn't just in the doctors, it's in the dirt, the bread, and the very design of the streets. In the United States, health is often viewed as a personal responsibility, a product of discipline and the ability to afford the best care. The American food landscape is a testament to a risk-based regulatory philosophy. The Food and Drug Administration generally allows substances to remain on the market until they are proven harmful. This has resulted in a diet heavy in high-fructose corn syrup, synthetic dyes, and growth hormones that are largely absent from European shelves. By 2026, the cumulative effect of these additives is visible. Nearly 40% of the American population is classified as obese, a figure that continues to drive a crisis in type 2 diabetes and heart disease. Europe operates on a fundamentally different logic, the precautionary principle. If a chemical or additive's safety is in doubt, it is restricted or banned before it reaches the consumer. Walking through a supermarket in Berlin or Madrid in 2026, the ingredient lists are shorter. There is no potassium bromate in the bread or titanium dioxide in the sweets. This isn't because Europeans are more disciplined, it's because their environment is curated to be less toxic. Health in Europe is treated as a collective infrastructure project rather than an individual hurdle. Nowhere is this infrastructure more apparent than in urban design. For an American, physical activity is often a scheduled event, a trip to the gym or a jog in a park. It requires a conscious choice and, frequently, a car ride to get there. In contrast, the European 15-minute city model has become the standard for 2026. In cities like Paris, Utrecht, or Milan, movement is passive. The grocery store, the school, and the office are accessible by foot or bike. This constant, low-intensity movement acts as a natural buffer against cardiovascular decline. While Americans fight the sitting disease with standing desks and expensive wearable tech, Europeans are simply walking because their cities demand it. But here's the part nobody talks about. The health gap isn't just about what we eat or how we move. It's about the psychological toll of the systems themselves. In 2026, the leading cause of the widening life expectancy gap isn't just cancer or heart disease. It's deaths of despair. The United States is grappling with a record-high rate of suicides and drug overdoses, fueled by a socioeconomic environment that offers little room for failure. In Europe, the social safety net, universal health care, mandated paid vacation, and robust unemployment protections acts as a physiological stabilizer. The cortisol levels of a worker in Sweden or Germany are inherently lower because the cost of a medical emergency is zero. In America, even with the best insurance, a single diagnosis can mean financial ruin. Stress is not just a feeling, it is a biological toxin that accelerates aging and weakens the immune system.
The payoff of these two systems is a study in trade-offs. If you are diagnosed with a rare, complex form of cancer in 2026, there is no better place to be than a top-tier American research hospital. The U.S. excels at the high end of medicine, intervention, innovation, and heroic measures. But for the average citizen, this excellence is irrelevant. Europe has chosen to prioritize the low end, the boring, consistent baseline of preventative care, clean food, and walkable neighborhoods. As we look toward the middle of the decade, the results are conclusive. The American model is a high-performance engine that frequently breaks down and is incredibly expensive to repair. The European model is a resilient, well-maintained machine that simply keeps running. One produces miracles for the few, the other produces a quiet, sustained vitality for the many. We are entering a period where wealth is being redefined. It is no longer just the balance in a bank account or the ability to afford the latest longevity supplements. In 2026, true wealth is the luxury of living in a society where you don't have to think about your health every waking moment, because the system has already thought about it for you. The gap between the two sides of the Atlantic is no longer just a matter of policy. It is a divergence in what it means to live a human life. The American will continue to outspend the world in a desperate race to stay young, while the European will simply continue to walk to the bakery, breathing cleaner air and eating cleaner bread, unaware that they are winning a race they never even realized they were running.